Statin drugs are the #1 most prescribed class of drugs of all time. Statin drugs are prescribed with the intention of preventing heart disease and lowering lipid levels. But what you may not know, and what research is showing, is that your statin drug that you're taking to prevent heart disease may be causing it. Recent research shows that statin drugs can cause coronary artery calcification as well as congestive heart failure. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. If you have to be on a statin drug, then you must know how that drug works and how it may hurt you. Research in the journal Expert Evaluation in Clinical Pharmacology recently put out a study showing that statin drugs can cause atherosclerosis and cause congestive heart failure due to the way that they work, meaning the mechanism that the drug works by causes nutrient deficiencies that then lead to the atherosclerosis and or the congestive heart failure. So what am I saying? What I'm saying is that the statin drug you're taking to save your life could speed your heart disease if you're not taking the nutrients necessary to compensate for the deficiencies the drug may be causing. The study shows that statin drugs inhibit vitamin K2 formation, and vitamin K2 deficiency leads to increased calcification of the arteries, so atherosclerosis. The study also shows, and many studies have shown, that statin drugs drive deficiency of coenzyme Q10 in the mitochondria. This study also shows that statins drive deficiency of heme A as well as selenoproteins. So heme A, selenoproteins, and CoQ10 all are needed for ATP production from the mitochondria. ATP is the energy currency in our body, specifically in this case for your heart. So if you can't produce energy from the mitochondrial powerhouses in your heart, and your heart's beating every second of every day of your life, but it's not getting the energy it needs, it has to work harder, and that can lead to congestive heart failure. So if you are a person that has to be on a statin, and to know that or not, you need to work with a practitioner who knows how to determine that. There are certain criteria that make a certain class of people the right person to be on a statin, and then there are criteria that make you the wrong person for a statin. Unfortunately, the way that conventional medicine is set up, they believe everyone's right for a statin that has a cholesterol higher than 200. That's not necessarily the case. But there is a best case or best situation or a best avatar of a patient that should be on a statin. So those people are who we're talking to right now. If you fit that class and you should be on a statin or need to be on a statin, then what you also need to do is supplement with the nutrients that statins are known to cause depletion of: CoQ10, vitamin K2, selenium, and glutathione wouldn't be a bad thing either. This is not medical advice, please don't take it that way. This is for informational purposes only, but you should speak with your practitioner about potential nutrient deficiencies that statins could cause and what they recommend to take and what dose to compensate for that. So wrapping it all up, you may be taking a statin because you were told if you don't, you're going to die of a heart disease due to hyperlipidemia. That may be true for a specific class of people. That class typically has a coronary calcium score of greater than 100 and many risk factors lab high on their labs associated with coronary artery disease. If you are not a person that has both of those things, then you need to speak in depth with your practitioner about why they're recommending a statin and the risk-benefit ratio associated with their reasoning. If you'd like to learn more about this, reach out to a functional medicine practitioner and Google statins, NNT, and read up.